Right. Hello, this is Dr. Bernard Willis from the Optical Wellness Centre in Auckland, talking today about testosterone for women. And before you all start shouting, why do women need male hormones? Let me tell you that, let me dispel the myth that both men and women have the same hormones. Okay? But obviously men have more testosterone relative to estrogen and women have more estrogen relative to men. Therefore, they both get the male and female characteristics. Okay? The bottom line is that both men and women need to produce testosterone in their bodies, although in different amounts. Women produce about 1/20th of the amount that men produce in a day. Some is produced in the ovaries, some is converted from a hormone called DHEA, which is an adrenal hormone, and it's testosterone in the body that's responsible for pumping energy levels, driving our desire to attack the day, filling the need to succeed, bonding us with our friends, fulfilling our sexual desires, elevating our levels of sexual satisfaction, growing hair on our heads, while at the same time keeping us from going bald. It builds muscle and burns off fat. It strengthens bones and prevents osteoporosis. A recent study indicated that women with osteoporosis who took a combination of estrogen and testosterone actually improved their bone density, and that has only been proved before with progesterone. So this was a landmark research has shown that testosterone plays an important role in cardiovascular health, especially in protecting us against atherosclerosis and heart disease. The heart muscle is full of T receptors. In fact, there are more T receptors in the heart muscle than there are in the genitals. And also testosterone dilates arteries. It's now been used in arteriosclerosis of the legs and dilates arteries to the legs, improving the circulation. Bioidentical testosterone supplements may be able to reduce circulating cholesterol more safely than statin drugs. Multiple studies also show that testosterone may help guard women against breast cancer. What happens to our testosterone levels as we age? Unfortunately, once we reach our 30s, available testosterone levels for both men and women begin to diminish. What's going on? Interestingly enough, it's not only actual testosterone production that decreases, less is produced by the ovaries and adrenals. As DHEA also is falling as we age, that's not there to turn into testosterone. But it also, the amount of free circulating or bioavailable testosterone decreases because more and more of it gets bound to a protein in the blood called albumin, and another one called SHBG, which stands for sex hormone binding globulin. But I'll just say SHBG. I won't keep repeating sex hormone binding globulin. The important point is that when bound testosterone becomes unavailable for use by the body, it means only a small amount of free testosterone is left. And that's the kind of testosterone which is active and able to enter a cell and activate a receptor. And considering as we age that the amount of SHBG steadily increases, it's easy to see that your level of bioavailable testosterone will only continue to decrease over time. The other reason that testosterone levels drop, even in young women, is oral contraceptives. They are associated with elevated SHBG levels and can decrease the testosterone level by 40 to 60%. And low levels of free testosterone are believed to play a major role in women's sexual health and could place women at risk for decreased sexual desire, decreased arousal, and decreased energy. But cheer up. Bound testosterone can easily be freed with a little help from some herbs. Herbs such as saw palmetto, wild oats, and nettles can reverse the binding process, increasing the testosterone levels by often over 105% on average. And the benefits for men and women are enormous. Specifically for women, women are far more vulnerable to testosterone level changes than men. The reason is simple: they have so little to deal with, to work with, and even less is on the pill. And when a small amount of available testosterone gets bound even more, the result is quite important in maintaining a woman's energy level and sense of well-being, regardless of her age. Deficiency can cause loss of energy, vitality, loss of the will and motivation to do anything, loss of interest in spouse or partner, loss of libido, and loss of sexual fulfillment. Loss of muscle and significant increase in body fat. This is the prime reason why women start to gain so much weight when they move into their 40s. Testosterone also contributes to overall muscle tone. Well before menopause, some women begin to suffer from embarrassment. This problem most likely relates to diminished testosterone levels because the pelvic muscles are particularly dependent on testosterone. Many women find that using a testosterone cream coupled with Kegel exercises helps to strengthen and tone those muscles again. Excess hair is a problem with lack of testosterone as well as too much testosterone. Okay. A significant increase in breast cancer is possible since the bound SHBG is no longer available to lock up excessive estrogen. How do we diagnose testosterone deficiency? Well, you can do three things. You can test the blood, you can test the saliva, or you can do a 24-hour urine test. Blood is more convenient, saliva is perhaps next best, and 24-hour urine testing is the gold standard. We always test with other hormones because we're trying to create hormone harmony in the body, a good balance of all the hormones. They all work well together. And if we do find that the low, replacement therapy is done with small physiological doses of a bioidentical testosterone cream or gel, doses that bring the testosterone level up to premenopausal levels, around early 40s to 45. Okay? In general, the doses given to women are approximately 20 to 30 times lower than given to men, because men produce 20 to 30 times more testosterone than women. In almost all cases, testosterone should solely be given to women who simultaneously receive estrogen progesterone treatment in adequate doses. Otherwise, signs of virilization occur. This is excess hair and deepening the voice, sometimes even a large clitoris, which are very unwanted. Are there any contraindications? Are any women who should not receive testosterone? Firstly, those with severe hirsutism, hair, overgrowth of hair, should not receive more testosterone. And those who are not taking progesterone estrogen creams, again, should avoid it. And if you're pregnant, you should avoid it. But generally speaking, testosterone is wonderful. They call it the hormone of love. If you feel that you may be suffering from a lack of testosterone, make an appointment with a doctor experienced in hormone restoration, and he will help you to rebalance your hormones. Thank you. Next time I'll be talking about the many benefits of the hormone progesterone. See you then.